As physical distancing initiatives start to get relaxed and we start to think about getting back to important things that we need to do. We need to maintain our health for other reasons. If we have other chronic diseases and need to get checked, do we need to go in and get vaccinated? Do we need to get screened for cancer or continue a treatment for a disease? When is it safe to go back into your doctor's office?
We've always had preparations about how we do this. We've expanded our capacity for patients that might have COVID and for a rapid influx of people. But the reality is, during this whole procedure, we've actually had more empty beds than usual. And more importantly, we've had people in the community who have actually been afraid to come in to get care, and they've harmed themselves, whether that's from a heart attack or a stroke or other things. So it is really important to make sure that when you need to see a doctor, if you have a symptom that you can't explain, at the very least, get on the phone and talk to your provider. Please don't be afraid to go to an emergency room or a doctor's office or an Indigo. They're safe and they can take good care of you, and our job is to keep your health as good as it can be.
We kept our environments very clean. We're doing more of that now. We're making sure that both the patients and caregivers have access to masking and focusing on hand hygiene, respiratory hygiene for all of our patients as they come in, as well as our staff.
So in many of our facilities, we are limiting visitors, and we've done that for a long time. We're asking visitors to put on masks. We have our staff in all of our clinical buildings also wearing masks. That's a very effective way at limiting spread. We try to keep people distant, so we started calling that social distancing, but now we like to call it physical distancing. And we have then always had the ability to use effective personal protective equipment to keep our staff safe while we treated people, even if they had infections. I think the most important thing is that your health is paramount, and avoiding or delaying care because you're worried about the virus could in fact do you way more harm than the virus might. If you have a heart attack and you don't get care soon enough, you will actually harm your heart. And today we can fix those things so you don't have any heart damage and you go back to normal activities very, very quickly. The same can be said of stroke. If we don't treat it rapidly and quickly, you can have ongoing deficits and disabilities that you may never recover from. So it is super important to get it on time, to know what's going on. If you have symptoms that you don't understand and you're worried about them, see your provider, get a diagnosis, and we'll keep you safe, and most importantly, we'll do our best to keep you well.